Good evening, everybody. Thanks for coming tonight on what is starting to get a little bit warmer outside, so we're getting a little more activity outside. So, quick question. Raise your hand if you would consider yourself pain-free. Is that one? She's a physical therapist. Okay, so there's a room of, I don't know, 15 people here, and only one person reluctantly raised their hand. So it's a pretty normal thing to be in pain for a lot of people, right? But what we want you guys to understand is that pain is not normal. And when people come to us, they want us to fix their problem. But really what we need to kind of fix is the things that they're not doing correctly that is causing the problem that is occurring. So tonight we're going to talk about knee pain. So you guys have this handout, right? So we're trying to make this as user-friendly as possible. For us to go through what knee pain is and how to fix that is longer than a 30-minute talk. But we're going to do the best we can in 30 minutes to try to get you guys to, one, understand how the knee works, and two, hopefully have some tools to try to help you figure out what's causing your knee pain, and then three, give you some actions that you can take after that. So this is a very interactive class. You guys are not going to be standing in those chairs for very long. You're going to be doing some activity. And if you have any questions about anything, then make sure you let us know. My name is Travis Robbins. I'm owner of Hospitality West. This is Katie. She is our physical therapist in Upper McCountry, which is on the other side of this wall. She's been here for 6 years. So we're going to educate you today about knee pain. So get your sheet out here. And the first thing you need to do, first of all, did you guys come here because I was going to teach you how to get your knee to last 110 years? Anybody think that's a reasonable goal to get your knee to last 110? What happens as you get older? What's the most common procedure that maybe you or your friends or family members have gotten?
Knee replacement.
Knee replacement, right? You just live long enough, you're just going to get those replaced, right? No, you don't want to. Why don't you want to get your knee replaced? It's a brand new knee, right? What? It hurts a lot. So Katie and I have done lots of post knee replacement therapy, and it's not fun for us either. You guys think it is fun for us because you think we're masochists, but yeah, that hurts. It's a great procedure. I'm glad they have it. I would love to see less of them in our office because, well, for a lot of reasons. One, your knees really are designed to last that long. It's kind of the things that we do to them that cause issues that we'll try to help you guys out. So we've got some people that are my age, so I'm kind of like my mid-40s. Katie's way younger than me. She's in her very, very, I won't say her age. She's much younger than me. So we've got some people that are older than me here. We've got some people that are way younger than me here. So this is great. So we've got some people that are in an older age bracket where they're like, man, like me, I'm kind of concerned, like, what do I need to do? I need knee replacements. I've seen a bunch of those, and they don't look fun to me. And then we've got some people here that are younger. It's like, hey, maybe I don't have any problems right now. Although the people that are younger here did not raise their hand. They consider themselves pain-free. So there might be some knee stuff going on there. But this class, this course, is for all people in between that. So understanding the top three causes of pain. Katie, when we have new patients come in, they come and say, yeah, I got pain in my knee. What are the most common things that are causing that knee pain?
So it's usually one of three things. So we have the meniscus, the inside of the knee. We'll see a lot of...
Can't hear her.
Everybody kind of familiar with those things?
We can't hear her.
Super easy terms. If you say, man,
we can't hear.
You probably have a patellofemoral problem. So your patella is this bone that floats around in the front of your knee.
We can't hear you.
A lot of mobility, and it is attached to your body by some tendons and some ligaments. And if you're not aligned properly, then sometimes that can cause issues. So who thinks they have really good balance and strength in their leg? Anybody? All right, I need a volunteer. We're going to be here all night, and I'm hungry. My kids ordered Chinese food. I just can't wait to get home and get that. So I need somebody to stand up here and do a quick test. Perfect. All right, so everybody's going to do this test. What's your name? Gwen. Okay, everybody's going to do this test with her. So we're going to stand up. Okay. And you can use your chair for a little bit of bounce. So Gwen, come on over here. And I'm going to let you put your hand on the table there. Okay, so don't lean on it, but just put your hand on the table just so you can bounce. Okay. Pick your good leg. What's your good leg? You got a good one?
I don't have one.
All right. So we're going to pick your left leg. So I want you to pick your right foot up. Okay, so you guys kind of you can use the chair for balance, or you can do it without chair. Good job. All right, so I already see people kind of struggling. If you can't hold your balance for a minute without too much trouble, then we need to talk. Okay, so that is a reflection of a lot of different things. You guys are doing pretty good so far. And now what I want you to do is just a mini squat. So you're just gonna try to get lower to the ground. Okay, good. And that's the bad knee. That's the replaced knee, and this is the one that we're trying to not get replaced. Got it. Okay. All right. So what happens when you do this? Hurts where? The front of the knee. On the inside. Okay. Someone says they have pain on the inside of their knee. Of the three things that we talked about here, what do you think the problem is? So it could be arthritis and meniscus, which kind of are tied together. When someone says, yeah, I got pain on the outside of my knee or the inside of my knee, they had some kind of traumatic issue that went on. It's probably the meniscus that's irritated. Okay? Not necessarily damaged, just kind of irritated. Okay? So who can go down the lowest here? So I'll just kind of take a look at everybody. So just try to do a squat where you go down low. Good. And then come back up. Good. All right. You're the winner. Okay? She's going to tag you out, because she's in so much pain she can't even tolerate going down further than that. So that's an issue. All right, so come up here, and you're gonna stand here. I'm not even gonna let you have the table. All right, so I'm gonna turn you guys into physical therapists. Right, we went to school for a long time, but it only takes like 20 seconds to figure this out. So stand on one foot. Good, and I want you to squat down, and you tell me what you guys see on her knee. Can anybody do that? Come back up. Good. Okay, and then come back down. Good, and then come back up. Anybody see anything? I can see it from here. What's that? It's straight. I wouldn't say that. That's what I want to have happen.
Yeah.
So what happens with her is that when she gets low, her knee kind of comes in a little bit. Okay? So when you guys are doing this on your own, if you're doing we call this a single limb squat, right? If I squat down, what I really should see is that I want my knee over the outside of my foot. Okay? If your knee comes to the inside of your foot, then you don't have the strength to stabilize your femur. Okay? And you can get away with that for a long period of time, decades and decades. But eventually that's going to catch up. Okay? So this is a self-test that you can do at home. You would want your knee to stay over the outside of your foot and your pelvis to stay level. Okay? So the other thing that happens is when she gets down a little bit further, what happens? Whoop, she gets a little like wobbly in here. Okay? That tells me that she can't turn on her external rotators, which stabilize her femur, and she's going to make compensations around that. Again, how many steps a day? Do you ever have like a tracker where you do like we got to dial it up right now. How many steps do you do a day? Almost 5,000. So like 5,000, is that like a normal day for you? Yeah, so some 5, 10, 15. Could you imagine doing an exercise wrong like 5,000 times? What do you think would happen? Evan would be like really mad, right? So if we did an exercise incorrectly 5,000 times in a day, probably something is going to go wrong, right? But we do it, right? We do it for thousands of steps a day, and we have mechanical inefficiencies, irregularities, and we can get away with it until we can't. So this is a movement dysfunction. Yes, the tissue that we talk about here, so these top 3 causes, this is kind of identifying that pain and putting it somewhere as a structural type issue, but really it's a movement dysfunction. Right? So if you can get things to turn on better, to better control that motion, then your knees will last longer. Right? So do you do a lot of single limb squatting during the day? Yeah. No. Sit at a desk. Okay. But you go up and down stairs, right?
Yeah.
Okay, so she's doing a lot of that. And even, if you're on one foot, you're putting all your weight on one side. Even when you're walking, right, there's short periods of time where all your weight is on one side. If you're not doing that properly, then you're going to run into problems. Does that make sense? Okay, so now all can evaluate someone's single limb squat. You can give them some information about, and you can evaluate yourself, right? So you can just kind of look in the mirror and do that. If you can't do that correctly, are you having any knee pain right now? No, good, okay. But that's eventually going to catch up with her, right, if she doesn't kind of clean it up. Does that make sense? Anybody have questions about that? All right, go ahead. Thank you for your participation. Katie, if you were going to find the cause of your knee pain, so now we're into box 2 here on your handout here. When someone comes in, what are the main things that we do to try to find out what's causing their pain?
We can't hear her. We can't hear her.
Okay. So the other thing, we take your history, right? So we find out the story. So when we ask you questions about what happened, very rarely does someone come in and say, "Yeah, I fell in a pothole and twisted my knee." Almost never, really, when we get the patients. They're like, "I don't know. I've been kind of doing the same thing all the time, and I woke up one day and had pain." So you got who has knee pain right now? Okay. Did something happen that caused your knee pain? Were you like, did you fall down a flight of stairs, bend down to pick something up? Nope. Okay. Just started bothering you, right? And you guys walked in here, right? So if you were like dragging a leg in here, excruciating pain, you'd probably be coming to this. You'd probably be going to the emergency room, right? So a majority of what we use to try to find out what's going on is really your story. So what caused the start of the knee pain, and how can we fix it? And then the other thing that we do is orthopedic tests. You guys know what orthopedic tests are? So you guys have probably heard of like X-rays and MRIs and that kind of stuff, right? So that's valuable information, but there's plenty of people walking around with terrible-looking diagnostics that don't have any pain at all. Right? So people tend to get they identify with their MRI, and we'll have patients that come in. I don't know why I'm here. I want to get an MRI to find out what's going on here. We can see what's going on structurally with an MRI. It's great because the previous to an MRI, we would have to open you up and kind of find out what's going on, which is kind of invasive and dangerous. So it's useful, but we say, we don't the scan, we treat the man. And sorry for women that are here, but this rhymes, so we couldn't fix anything. So we don't kind of treat okay, here's the problem that's going on. You have a torn meniscus. There's plenty of people walking around with torn meniscus that don't have any pain at all. So we're more treating what you told us when you came in, and your movement dysfunction. So what it looks like when you're doing a bunch of different tests. So who has pain in their knee right now that it's above 5 out of 10 at any point during like the last couple days?
Me.
All right, come on up. Yeah. All right, tell us what happened. Okay, tore meniscus a long time ago. You've had the test, so there's diagnostic arthritis, which is true. Right? So I have terrible arthritis in my low backs. I had herniated disc when I was in college, and on my scans it looks really bad. I almost never have back pain, so I have arthritis, but I don't have any symptoms of arthritis. You want that? Okay. Now that's not to say that you have scans and they say arthritis, and you're just full of crap. You're just like faking it. That's not true either. So there's a balance in there. But you went to a doctor and they said, yeah, you've got arthritis. And then what did the doctor say to you after that? Yeah, injections, super common. Uh-huh. Okay. Okay. All right. So you did gel shots of all sorts of stuff in there. Chicken fat, shark cartilage, and hearts health for a while. Okay, so you always had the problems here. You had a diagnosed meniscus tear, and now this one is starting to bother you. You're making compensations around the fact that this knee's not working as well as it should. So let's hop up here. Katie's going to do some tests on your knee to try to find out if we can see if we think the meniscus is involved. So if you have diagnostic testing that says the meniscus is like shot, but we do a bunch of orthopedic tests, like move your knee, and nothing bad happens, then is that really what's causing the problem? What percentage? Go ahead, Katie. You can do some tests. You need the microphone now? Okay.
Okay. Hello? Cool. All right. So just to check out, if I'm strictly going to look at meniscus, I can have you go ahead and actually have you stand up. We'll do a test, and you can come over here just so that you can kind of see on there. Face the table for me. And which side is it that is bothering you? This one? Okay. All right. So let's pick that one to start. So you can stand here. I want you to slightly bend your knee for me. Okay. And what you're going to do with your upper body, you can use the table for balance if you need it, is you're going to kind of do like a twist. So you're going to try to twist and face your kneecap to the right, and you're going to try to twist and face your kneecap to the left. Okay? So this is a test called Thessaly's, so it's looking for some meniscus pathology. If you've got a real significant meniscus tear, this is going to shoot you like right through the roof. Not fun at all, okay? And then you can try the same thing on the other side, just so you can kind of see from side to side how it feels. A little bit of a bend in the knee and rotation. So what meniscus don't like is knee bends and rotation. So that's kind of a similar theme throughout a lot of the orthopedic tests that we do. So you can go ahead and come up and actually lay on your back for me. You can use the pillow there. All right, so go ahead and lay all the way down. So then, same deal. We're going to go. I'm going to take you, just going to bend your knee. Just let me know if you have any pain as I'm doing that, okay? Just relax in this here. I'm going to bend you down here. You okay there? Okay, I'm going to give you a little bit of rotation, okay? So from here, I'm checking to see if you have any symptoms. I'm also kind of feeling for the quality of the movement in the joint. Does it feel like it's going smooth? Does it feel a little clunky? Is it stiff? A little bit crunchy? And then we'll do the same thing here on the other side. You okay there? Okay, let me give you a little bit of rotation here and a little bit of rotation there. You okay there? Good. With any diagnosis in PT, we have a slew of different testing that we can do. Those are just two of them, but there's other tests that you can check out for meniscus as well. She wasn't too irritated with either one, so I'm not suspecting that there's any kind of giant hair in there that's kind of harming your motion or anything like that. Good. All right, hop on up.
All right, you're done. You go. All right, do you ever have any like clicking or popping or locking in your knee? Oh, we got a hand up over here. Okay, yep. So that's consistent with meniscus problem. But this is a really good example. We did some orthopedic tests. If you had not told us that you had a meniscus tear, I wouldn't think you had a whopping meniscus tear. Katie wouldn't get a whopping meniscus tear based on what's happening, right? So how important is that diagnosis? It's not going to change anything that we do. A lot of people will come in and they'll say, well, don't I have to get an MRI so you know what you're doing? I'm like, no, I don't really want your MRI because it will tend to throw us, right? So if you're not having like huge meniscus irritation type issues, if you're not having huge meniscus signs, then maybe something's going on in your hip. Maybe the pain in your knee is coming from your low back. So we'll commonly see patients that have knee pain. What do you do when you have knee pain? You go in to see your doctor, right? You do some injections. Maybe that helps, maybe it doesn't. And then they do a diagnostic test, and they look at how much space is between your femur and your tibia. Not much. What are you going to do in that situation? Do a knee replacement. We've had patients come in and say, yeah, they did the knee replacement. Everything went fine. I still have that knee pain. It's because the pain did not come from the knee. It came from their low back. Okay? So when you have diagnostic testing and you just solely go on that, which really orthopedists do, that's kind of their job, right? That's the tools they have. Then sometimes I need to check out your low back to make sure. Do you ever have any back problems? No? Okay, so there might be something going on there. Might not. It might be true, like irritation there. But certainly with the testing that we did, there's not like, well, there's nothing we can do here. You have to go get surgery in order to get this fixed, which typically most people like. Although some people do associate surgery with fix. Please don't ever do that because once you do a surgery, there's no going back. It's an amazing tool. I'm glad it's there. Some people probably. But we try to exhaust everything else before surgery because sometimes surgeries don't go well. We see that on our table. Okay. All right. So those gives you kind of an idea of how we would kind of evaluate what's going on and you figure out what's going on. Now we've got to come up with a plan, and in physical therapy we come up with a plan, and then you do, of course, physical. Who here has never had physical therapy? Raise your hand. All right, so kind of an idea of what physical therapy looks like, right? Is there anybody here that's not having any knee pain at all? I know nobody raised their hand. No knee pain. Perfect. Come on up here. Careful raising your hand. There. All right, so whether you're having knee pain or not, we're going to show you probably the most important thing you can do to get your knees to last the next time. Right? I lured you in here with this 110 years. That's how we're going to do that. So what we want to try to do is express full range of motion in the lower extremities, which we probably rarely do. Right? So now everybody's going to stand up. Okay? And I want you to stand behind your chair. So if you got to scoot your chair around a little bit, then we'll do that. And you're the big winner because you don't have to switch chair. Okay. So what we're going to do is a full squat. So before you do anything, when is the last time that you guys spent any time in this position? When you were 5. in class, you were down here and you spent time here? 30 seconds. Okay. Good. 45 minutes. Okay. Right. So, what you should be able. So I do this for 10 minutes a day. So if you won't be able to, that's a good idea. I'll just start doing that. Please don't do that. Right? Well, you won't be able to do it because when I started doing it, I couldn't do this. But if you can express full range of motion in your ankles, knees, hips, and low back, this is like one of the easiest things you can do to prevent issues with long-term, especially ankles, knees, hips, and back. Problem is, it's kind of hard to do this if you've never done it before. So when you guys did your first workout here, did you feel like $1 million after, like a couple days? No? Okay, because it's something you're not used to doing, so treat this like a workout, okay? So what you're going to do is to try to get into this position. Now, for you, that might not be the safest thing to do because your range of motion is not amazing, but I want you to try to go down as far as you can go and you want to try to look like me. You might not get here. You're going to go as far as you go there. Stop if you're having pain. Okay, if you're having pain anywhere, not just in your knees, but in your low back. Use something that's pretty darn good. Here's some rules I'm going to give you, okay? Your feet have to be straight ahead, or pretty darn close to straight ahead. What a lot of you are doing right now is you'll turn your feet out like that, okay? That's because you don't have the ankle range of motion to do this. So that's the compensation that you'll make. So your feet have to be straight ahead, knees have to be out, and your heels have to stay on the ground, okay? So you cannot have your heels come up off the ground. And you guys are doing pretty good. Heels are off the ground like that. Evan, you got a slant board in here? So this is what's happening with him. He goes to squat down, and what happens is ankles come up like this, okay? Because he doesn't have the ankle range of motion to do that. So that's going to be a problem that we have to kind of fix here, or else we're going to have problems there, right? So here, come on, we'll do this. This is perfect now. All right, so you guys can kind of play around with that. See how low you can go. So first, here, without any help, I'm just going to just try to go down and squat down as far as you want to go. Okay, and ankles start to come up there. And actually, that's pretty good. Okay, good knee flexion, good hip flexion. All right, come back up. All right, now do the same thing and put your heels like this. Okay, and just try to squat down. Okay, a little different. Okay. He can get more range of motion now because he's not struggling so much with his ankles. Do you feel pain in the knees? Okay, and then come back up. Both knees? Yep. Okay. Do you have knee pain normally with the stuff you're doing around the house?
Knees and had some sort of tear.
Okay. All right. So ice hockey, geezer league.
Yes, goalie. So they take a penalty.
Yeah. Okay. So that's repetitive use, kind of like wear and tear stuff. Doesn't mean you're going to have knee pain forever, but you got to make some kind of change in that. Like pain is your body's request for change. You're doing something that your body doesn't like. It's giving you like the check engine light, right? Your engine's still running, like you walked in here, but the check engine light is on. Everybody drive around with the check engine light on? You can do it for a while, yeah. But eventually something bad's going to happen, right? So this, actually, and that's great. Thanks. You can go back to your chair. How'd you feel doing that? Do you have any pain? Okay, so go down as far as you can go and stay there. So you can hold this. I want this to be a passive squat, okay? When you first start out, I don't want you to use a lot of muscles doing this, okay? So you're kind of hold on to something, banister, table, it's not going to run away from you. Door frame works really well, and you're just going to hold on to this, and you're trying to get your hips down to your heels and just kind of hang out here. Eventually, when you get good at it, then you'll do it unsupported. But for right now, I just need you to express full knee, hip, and ankle range of motion. If you did this, you made this a daily practice, and you did it for 5 to 10 minutes a day, I would argue if you start out with fairly healthy knees, you probably will never need a knee replacement. Why would it hurt behind? In the back of the knee or back of the calf? Back of the knee. So why would you have pain in a full knee flexion? How much time do you spend there? Ever? In the past? Yeah. Right. So if you do something you're not normally used to doing, your body will probably let you know about it. Same thing. So we made that worse. Yeah, that's how we get you to sign up for physical therapy. Yeah. Okay, so pain in the back of the knee. Sometimes that can be a Baker's cyst. Have you ever had somebody tell you you had an ankle? Stop. Yeah, you just keep going. I'll have it in a timer. Because you have good knees. Okay. Okay. Yeah, sometimes those don't get, like, diagnosed. That's the first thing that I think of. So when you get into full knee flexion, you have more stuff there that's supposed to be there. So you guys know what cysts are? Cysts develop as a result of stress. If you go to get full range of motion in a joint that has a cyst in it, I don't like it. So I would want to get that checked out. Again, that's something that typically we would do, like, surgically. You've got to kind of work your way around that. But that could be one thing that's causing pain in the back of the knee. But that's kind of rare, actually. Like, a lot of people have pain in the back of their knee. Most people have pain in the front, patellofemoral problem, on the side, meniscus, arthritis type stuff. And so I would have to kind of check that out and try to find out what it is. But for sure, because it doesn't need full flexion. So spending more time there in the beginning could probably irritate that. But for the long run, I would argue that's going to be one of the best things you can do for knee health. Okay? All right. Any questions about that? So I've given you all the tools you need to get your knee to last 110 years. You just have to spend more time in full knee flexion, tolerate that, and be able to. So look at this. This is great. How about that? That's amazing. Well, so with a knee replacement, she's probably it's never gonna look like mine, which is fine. But she can't be like, well, this knee is replaced, so everything's fine. I don't need to take care of it anymore. Now you've got to really maintain that, right? So doing that is really, really important. Question? Yep. So this is, I'm glad you brought that up. In Western societies, we like line up at the door for knee and hip replacements. You know where those are like so rare? In countries where either culturally they spend a lot of time on the floor. So in Japan, they eat most of their meals on the floor. Right? Japanese people don't get knee replacements. It has a lot to do with diet, so yeah, it's very long. My half hour is almost up, and I was told I can only talk for a half hour, but we could do a whole other half hour on that. It does have a lot to do with your diet. Western diet is typically inflammatory, and that will kind of chew up the joints quickly as well. But for the most part, almost all of you said, I don't spend a lot of time here, so her knees are feeling pretty good. You doing all right? Any pain anywhere? Awesome. Okay? Not everybody's going to be like that, but if she does this for 5 to 10 minutes every day for the rest of her life, I'm willing to bet my next paycheck that she's not going to need knee replacements. Okay? You have to run those joints through full range of motion, and they have to kind of experience what that is. But for most people, we don't do that much, right? We sleep on a bed that's this tall. We go to a car where the seat's here. And then we go to a job where we sit all day, right? And we really don't even get up and off on the floor very much. And you don't know what this feels like. But I'm getting to the age now where it's like, wow, why am I having some trouble like getting up and down from the floor? Why are things starting to bother me a little bit? And then pretty soon, I'm going to be your age. And if I don't do something about that in terms of just kind of forcing myself to get through that full range of motion, then I'm going to start to have problems. So this is very much like brushing your teeth. You probably, some assumptions, you probably would not go years without brushing your teeth, right? Or else we'd know about it. Okay? But we do very little to maintain our bodies. So I'm asking you for, even if I say 10, because I know, like if I got 5, I'd be lucky. So like, if you gave me 5 minutes a day of doing this, you'd certainly have much less knee pain, and your knees would last a lot longer. Does that make sense? Anybody have any questions about that? You can do that with knee replacements, yeah. You might find that your doctor tells you, what did your doctor tell you about your knee? Did he tell you things, or she tell you things that you couldn't do? Can't kneel. That's pretty common, and that's a fairly good guideline. Yeah, can't run. Unless a bear's chasing you, then you want to run. Right, so avoid. So what happens, let's kind of narrow your activity. What's one of the most common things you do as you get older if you're looking for a different house? Ranch floor, right? Why do we do that? Don't have to do steps. We don't say have to. We say get to. You don't get to do steps anymore. It's one of, yeah. It's one of the most important. So we tend to narrow our activity, which is the opposite direction we should be going. We should try to expand our activity, do it for as long as we can. Now running, at some point, hopefully I will be old enough to where I can't run. But for normal stuff like getting into a squatting position like this, going up and down stairs, getting onto the floor, and then getting back up, really, really important to do. Those things you don't want to narrow those kinds of activities. Look at this. She's amazing. She's never going to need my help. You're starting to fall asleep. What's that mean? So she's putting pressure on the nerves that supply sensation and motor function to her feet because, guess what? She's not used to doing this, right? Her body's like, whoa, what are you trying to do? Okay? But the more you do that, the less you'll have that symptom. You can stand up now. Okay. Good job. All right. So at the bottom here, here's some next steps. If you want to learn more, again, I was only given 30 minutes. I got to get out of here. I have some extensive information, some blog posts on there, some podcasts that we have. If you're having pain, that's not normal. Right? So everybody that comes to hear me and Katie talk, we offer them a free screen. So a free screen is a 30-minute appointment with one of our PTs. If you come over here, you're going to see Katie. I might be here. You never know. But most you're going to see Katie. She's way better than me, so you're lucky now. 30 minutes, 101. You can get questions answered about anything you want, really. But if you're having knee pain, then we're going to do some of the evaluation techniques that we do here, try to find out what's going on. Results from that are probably pretty good. If you're not having too much pain, we'll give you a couple things to do. Do this for a couple weeks. If that doesn't get rid of it, then let's have a different discussion. If someone's coming in, at any point in the last 2 weeks had pain over a level of like 4 or 5, like 0, no pain, 10 we go to the hospital, 4 or 5, like your check engine light is on. Like you need to get that figured out. Or something more disastrous is going to happen. So we're trying to prevent that. So if you guys are interested in doing that, then you need to sign up with Zoe and get you scheduled in for free. It's free, okay? I can't make this any easier for you. It's absolutely free. 30 minutes one-on-one with one of our PTs. If you're having any kind of pain, knee, hip, ankle, we treat everything. But for the purposes of this, you guys probably are more interested in knee pain based on the topic for today. And you should come in and get a free screen. We can give you options about what you can do to try to get your knees to last 110 years. Any questions about anything? All right, Katie and I will hang out here for a little bit. You guys can, if you want to sign up for a free screen, then come talk to Zoe. And if you guys have questions about stuff, you can just ask us. Thanks, guys. Oh, applause. Oh, nice.